Have you ever realized that most people don't think about their heart health until it's too late? Many assume heart issues are simply inherited or just part of getting older, but that's not the full picture. After speaking with numerous heart surgeons over the years, one thing they quietly reveal when treating older patients is that these individuals tend to have very similar daily habits. These habits seem harmless and normal, but over time, they gradually damage the heart, much like how sandpaper slowly wears down wood. If you're in your 60s, 70s, or 80s, there's encouraging news. Some of these harmful habits can be changed, and others can be avoided if you catch them early enough. This isn't meant to alarm you, but rather to share what doctors observe regularly and to help you avoid facing the same challenges. In this video, we'll explore 7 common daily habits found in nearly every older patient who ends up needing heart surgery, habits they often don't realize are harmful. You might recognize some of these habits in yourself or someone close to you. Understanding these patterns could be what keeps you from needing surgery and helps maintain a healthier heart. So let's dive in and learn more. Habit 1. Skipping breakfast or consuming sugar. Heavy morning meals. One of the most frequently mentioned habits by heart surgeons is how many older patients either skip breakfast completely or begin their day with the wrong type of food, usually something sugary, quick, and convenient. At first glance, this might not seem like a significant issue. Many people simply grab a muffin, pour a bowl of sugary cereal, or rely on just coffee to get going in the morning. However, there's more to it than that. Your heart's rhythm, blood pressure, and overall energy depend heavily on what you eat or don't eat right after waking up. When you skip breakfast or consume a lot of refined sugar first thing in the morning, your body experiences a spike in blood sugar followed by a sharp crash. This roller coaster effect puts your body into a stress state, often increasing cortisol, the stress hormone, and disrupting your insulin balance. Over time, this daily stress places extra strain on your cardiovascular system. Your arteries can tighten, your blood may become thicker, and your heart has to work harder to maintain balance. There's also a psychological angle to consider. People who skip breakfast or choose unhealthy morning options often end up overeating later in the day, reaching for salty or fatty foods to compensate for the morning's nutritional gap. This creates a vicious cycle where poor morning habits lead to poor evening choices, squeezing the heart from both directions. While you might not notice these effects immediately, over the years, these small daily decisions contribute to plaque buildup and artery stiffness, issues that may eventually require surgery. I recall a man named Harold, a 76-year-old retiree, who used to say, "I've never been a breakfast person." Every morning he'd have only coffee and a slice of toast, sometimes just coffee. For years he felt fine, but gradually his blood pressure climbed, his cholesterol worsened, and chest pain started appearing. When he finally needed surgery, his doctor explained that these problems didn't appear suddenly. They developed over decades of those daily habits. To protect your heart, it's crucial to start the day with nourishing food, something rich in fiber, protein, and healthy fats. Simple options like oatmeal with nuts, eggs with vegetables, or whole grain toast with avocado can help stabilize your body's systems. It's not about being perfect. It's about creating a reliable foundation your heart can count on. Breakfast isn't just the beginning of your day. It sets the tone for how your body will handle the next 24 hours. Habit 2. Suppressing emotions and avoiding deep conversations. This habit might catch you off guard, but it's something heart surgeons mention more frequently than you might expect. Many older patients who required heart surgery shared a common trait beyond their physical health. They tended to bottle up their emotions. They held on to pain, stress, anger, regret, and grief, not just for a short time, but for years, sometimes even decades. What many don't realize is that the heart isn't affected only by physical factors. It's deeply influenced by emotional experiences as well. When you feel emotionally isolated, unheard, or unsupported, your body doesn't simply ignore those feelings. Instead, it reacts physically. Your nervous system becomes more sensitive, your blood pressure remains elevated, and your sleep quality suffers. Over time, this constant low-level stress accumulates, placing a burden on your heart that no amount of exercise can fix. Studies have found a clear link between keeping emotions inside and heart problems. People who avoid expressing their feelings are more prone to irregular heartbeats, higher inflammation, and a greater chance of sudden heart-related issues. It's important to understand that opening up isn't a sign of weakness. It's a crucial part of maintaining your health. When you hold in difficult emotions, it's like holding your breath. You're forcing your heart to handle more stress and oxygen debt than it should, which can eventually cause serious damage. I remember Elaine, an 80-year-old woman who was the steady support for her family. She never voiced complaints and always wore a smile. But after her husband passed away, she kept her grief hidden, constantly insisting, "I'm fine." A year later, she suddenly collapsed while gardening due to heart failure. Her doctor pointed to blocked arteries, but her daughter later told me, "It felt like her heart had been quietly breaking for years, and none of us noticed." You don't need to share everything with everyone, but it's vital to find someone, a friend, family member, or therapist, with whom you can safely express your feelings. The heart functions as a pump. It needs flow and release, not constant pressure. If you found this insight helpful, please comment number 2 below to let me know you're here. And if you haven't already, consider subscribing and turning on notifications so you don't miss future videos. Your support helps us keep creating valuable content to educate and inspire you. Now let's keep going. Habit 3. Relying too much on painkillers instead of addressing the underlying causes. Heart surgeons often see a troubling pattern among older adults who depend heavily on over-the-counter pain medications just to get through their daily lives. Whether it's knee discomfort, back stiffness, or headaches after restless nights, many reach for a pill without much thought. What might start as occasional use can easily become a steady, daily routine, and that routine can quietly harm your heart. Common pain relievers like ibuprofen or naproxen may seem harmless when they're just sitting in your medicine cabinet. However, when taken frequently, especially on an empty stomach or without medical advice, they can raise blood pressure, affect kidney function, and place extra strain on the cardiovascular system. For people already dealing with issues like high cholesterol or arterial plaque buildup, this additional stress can push the heart over the edge. I recall a man named Carl, age 76, who appeared healthy and active, playing golf twice a week. Yet he masked persistent knee pain with daily ibuprofen. When he suffered a minor heart attack and went in for surgery, doctors found years of silent damage in his arteries. The surgeon explained, "This damage didn't happen overnight. His heart had been burdened by those pills for years." The problem isn't just the medication itself, it's what those pills are replacing. Each time you take a painkiller, it may mean missing out on opportunities to stretch, rest, seek physical therapy, change habits, or listen to what your body is really trying to tell you. Your aches aren't always just a sign of getting older. Sometimes they're warnings. Taking painkillers is like silencing a fire alarm without checking the stove. Many older people fall into this pattern not because they're careless, but because they want to stay active, helpful, or avoid troubling others. But your heart doesn't care about your good intentions. It reacts to pressure, circulation issues, and inflammation. If your joints ache or headaches are frequent, dig deeper. Don't let quick fixes become long-term damage. This isn't about avoiding medicine altogether. It's about not letting it become your first and only solution. Treat the cause, not just the symptoms. Your heart will appreciate it with every beat. Habit 4. Skipping breakfast or eating too late. Skipping breakfast might seem harmless. Some even believe it helps with weight loss. However, heart surgeons repeatedly observe that patients who regularly skip their morning meal or delay eating for long stretches tend to experience more problems with blood sugar regulation, blood pressure, and overall heart health. The issue isn't simply about hunger, it's about how the body reacts to extended periods without nourishment. While you sleep, your heart remains busy, pumping blood, repairing tissue, and maintaining essential functions. But when you don't provide your body with food soon after waking, cortisol, the stress hormone, spikes to compensate. Elevated cortisol levels raise blood pressure and place strain on your arteries over time. Combine this with drinking coffee on an empty stomach without any fiber or protein to balance it, and you're starting your day with added stress rather than support for your heart. Take Eleanor, a 68-year-old woman who believes skipping breakfast helped control her weight. Her routine was to have a strong cup of coffee in the morning, run errands, and maybe eat something around 1 p.m. By then, her blood sugar would plummet, leaving her dizzy and reaching for whatever snacks were available, usually processed or salty foods. While this made her feel like she was managing her day, her body was actually in a state of silent distress each morning. After her second heart surgery, she worked with a nutritionist and realized her habits weren't about balance, but about chronic stress. This habit becomes dangerous because your body adapts to survive, not to thrive. Skipping breakfast triggers hormonal changes that influence appetite later in the day. Most people who skip their morning meal end up overeating at night, which can increase cholesterol and triglyceride levels, both significant risk factors for heart disease. For older adults, the negative effects tend to appear sooner and more severely. Breakfast doesn't need to be a large meal. What's important is providing your heart with something useful: fiber, protein, and healthy fats. Even a small portion, like a handful of nuts and a piece of fruit, can help stabilize your body's systems. The key is consistency and sending the message to your body, "I'm here to support you." This seemingly minor habit is often overlooked because it doesn't feel risky, yet it's one of the first questions heart surgeons ask for good reason. Starting your day by nourishing your heart is a simple yet powerful step toward protecting it. If you're still watching and finding this useful, please comment number 4 below to let me know you're here. And if you haven't already, consider subscribing and turning on notifications so you don't miss future videos. Your support helps us keep creating valuable content to inform and inspire you. Now let's keep going. Habit 5, sitting still for too long. You might assume that resting more as you get older is harmless or even beneficial. However, heart surgeons have observed time and again that older patients who spend long stretches sitting without taking breaks to move are much more likely to develop weaker cardiovascular health. This isn't about skipping workouts at the gym. It's about failing to get up and stretch or walk every hour or two during the day. When your body remains inactive for extended periods, blood circulation slows down. Blood tends to pool in the legs, forcing the heart to work harder to deliver oxygen and nutrients throughout the body. Over time, this lack of movement decreases the flexibility of blood vessels and promotes the buildup of plaque in the arteries. It's like a silent storm brewing inside your veins, even though everything appears calm on the surface. Consider Frank, a 75-year-old retired accountant. After retirement, he spent most of his time watching TV, doing crossword puzzles, and only moved when absolutely necessary, like using the restroom or answering the door. Eventually, he experienced chest tightness and shortness of breath. His cardiologist diagnosed early signs of congestive heart failure, not because of weight issues or smoking, but because his heart had weakened quietly due to inactivity. The key isn't about becoming an athlete or exercising vigorously. It's about simply moving more often. Standing up every 30 minutes, stretching your arms, or taking brief walks throughout the day makes a big difference. Even light activities like doing housework or tending to plants help keep blood flowing and the heart beating in a healthy rhythm. Think of it like lubricating an engine. You don't need to rev it up all the time, but you do need to keep it running smoothly. Here's the truth: sitting too much doesn't just harm your heart. It impacts your blood sugar levels, mood, and sleep quality. But the heart is usually the first organ to suffer quietly. It can't alert you loudly. It just continues working until it can't anymore. While surgeons can repair arteries and place stents, they can't reverse years of inactivity. That responsibility lies with you, starting with small, consistent movements that remind your body you're still in the game. Habit 6, overlooking chronic stress and emotional burdens. Many people believe heart problems stem solely from physical causes like diet, exercise, or genetics. However, heart surgeons frequently observe something else. Patients arriving for surgery often carry years of unacknowledged emotional stress that has quietly undermined their heart health. The heart reacts not only to physical strain, but also to emotional turmoil. These feelings aren't just abstract. They cause measurable changes in blood pressure, heart rate, and hormone levels. When these emotional responses happen repeatedly, they erode the cardiovascular system, much like water gradually wearing down stone. Take Joanne, a 68-year-old widow who lost her spouse 6 years ago. She lived alone and insisted she was managing fine. Friends admired her strength and independence, but she struggled with poor sleep and experienced chest tightness whenever she faced stressful situations. During a routine checkup, her doctor found high blood pressure, irregular heart rhythms, and early signs of artery hardening. While her diet and exercise habits appeared reasonable, it was the chronic emotional stress she'd been carrying that was the real culprit behind her declining heart health. The heart is tough but also remarkably sensitive. It holds on to stress. Prolonged emotional pressure keeps the body locked in a fight-or-flight mode, releasing stress hormones such as cortisol and adrenaline. These hormones increase heart rate and narrow blood vessels, which over time heightens the risk of high blood pressure, stroke, and even sudden cardiac arrest. Many older adults were raised with the message to tough it out, to suppress emotions, not complain, and keep going no matter what. While resilience is admirable, bottling up emotional pain doesn't make it disappear. It forces your body to carry a heavy burden. The encouraging truth is that releasing emotions is a form of healing. Whether through talking with someone, journaling, practicing breathing exercises, prayer, or meditation, these methods aren't just gentle suggestions. They're powerful tools for protecting your heart. Just as you wouldn't ignore a leaking pipe at home, you shouldn't leave a stressed heart untreated. Remember, it's okay to feel, to rest, and to care for your heart both physically and emotionally. If you're still watching and finding this helpful, please comment number 6 below to let me know you're here. And if you haven't subscribed yet, please subscribe and turn on notifications so you don't miss future videos. Your support helps us keep creating valuable content to inform and inspire you. Now let's continue forward. Habit 7, neglecting regular heart health checkups. Among all the habits heart surgeons highlight, this one is perhaps the most frustrating and completely avoidable. Far too many older adults only discover serious heart problems when the situation has already reached a critical stage. The main reason? They avoid or delay getting their heart health checked until it's too late. Think about it. We don't skip oil changes for our cars or wait until the roof collapses before inspecting it. Yet many people, especially after retiring, stop scheduling regular heart screenings. Some say they feel fine and see no reason to go. Others fear receiving bad news. Many simply don't know what signs to watch for. But here's the reality. Heart issues often develop silently, long before any obvious symptoms appear. Conditions like high blood pressure, elevated LDL cholesterol, high calcium scores, or abnormal EKG readings can provide important early warnings well before a heart attack occurs. A simple annual checkup that includes blood work and, if needed, an echocardiogram or stress test can detect these issues early on, allowing for effective management before things get dangerous. Consider George, a 76-year-old man who noticed he was moving a bit slower but didn't think it was serious. His daughter convinced him to get a thorough examination, which revealed over 80% blockage in one of his coronary arteries. He received a stent, changed his diet, and is now doing much better. Without that checkup, his outcome could have been very different. Not knowing your heart's condition isn't peace of mind, it's a risk. Heart problems often don't announce themselves with dramatic symptoms until they become life-threatening. In fact, the first warning might be a silent heart attack. Many surgeons express regret that their patients didn't come in for evaluation months or even years earlier. Preventive care goes beyond avoiding pain or emergencies. It's about adding more quality years to your life, boosting your energy, and preserving your independence. Your heart has supported you through every stage of life. It deserves at least a yearly check to ensure it can keep doing so. Taking that simple step of regular heart screenings could make all the difference. Final thoughts. We often think of bad habits as small, harmless things, like biting nails or skipping a walk. But the reality is that some of the tiniest, most overlooked daily choices can have the biggest impact on your heart health. This is the message heart surgeons want us to understand. The patients they see rarely made just one big mistake. Instead, they developed years of small habits that gradually took a toll. The good news? It's never too late to make a difference. No matter your age, your heart can improve with better habits. You don't need to be perfect. Just start somewhere. Focus on changing one habit at a time. Give your heart a bit more oxygen, more rest, and more movement. Your heart will respond and thank you for it. Think back on the 7 habits we discussed. Did any of them resonate with you? Maybe it's something you've been meaning to fix, or something you hadn't realized was linked to heart health before. Recognizing these habits is already a big step forward. Let's not wait for a sudden emergency or a harsh wake-up call. Instead, let's take control while we still have the chance. Remember, you're not alone in this journey. We're all learning, growing, and striving to do a little better each day than we did the day before. Thank you for watching today. We'd love to hear your thoughts. Please leave a comment below sharing one key takeaway and how you plan to apply it in your life. Your feedback means a lot to us and keeps us motivated. If you found this video helpful, please like, subscribe, and share it with others. Your support allows us to keep creating valuable content to inform and inspire. Thanks again for joining us, and we look forward to seeing you in the next video.